Hello everyone! In this video, we will be talking about what is ward checking and the process of ward checking. Firstly, what exactly is ward checking? Well, to put it in simple words, it's like doing a spot check of all the wards in the hospital. It is a routine inspection of drug inventory in hospital, and it is carried out by pharmacists along with the ward nurse. The frequency of ward checking depends on each hospital. However, the ideal frequency of ward checking set by KKM is 3 to 4 times a year. There are 10 main objectives of doing ward checking. First is to ensure that the ward stocks comply with the amount approved. Second is to make sure that the expiry dates of all the drugs are clearly labeled. Third is to ensure that the overstocked products are retrieved. Fourth, to make sure that the expired pharmaceutical products are confiscated. Fifth, to ensure that the drugs are properly labeled, arranged and kept in a clean cupboard. Sixth, to make sure that the emergency drugs are available and in good order. 7. To make sure that the medication trolleys are checked regularly. 8. To ensure that the refrigerated items are stored appropriately. 9. To make sure that the psychotropic drugs are used, stored and recorded according to the requirements of the existing law. 10. Is to make sure that the appropriate dispense technique and nursing standard are maintained. Now, let's go through the procedure for ward checking. We shall do so by watching this first video.
Good morning everyone. Thank you for attending this brief meeting. We are all here to discuss about the ward checking.
Okay, let's stop here for a second. You see this guy over here? He is the stock ward pharmacist. He will be the one setting the date for ward checking as well as planning the ward checking schedule. The date for ward checking must not be revealed to the nurses, and the ward check must be done within the time frame set. Okay, let's continue with the meeting. Please listen to the content of his speech.
So, since it is our hospital regulation to do it twice a year, this November will be the time to do the second ward checking. The checking for each and every ward should be completed in 1 month time. We will start on the 5th of November 2014. Do kindly update your documents and stocks before going for ward checking. This is to make things clearer. Also, a report on the ward checking should be done. An appropriate recommendation can be given to improve the medicine supply in the ward. That's it. Thank you.
The next step for ward checking is that the pharmacist should identify major problems from past documentation. Now, let's watch the next video to see what is the next step for ward checking. Okay, let's pause here for a second. You see this sweet lady over here? She is the senior nurse, or more commonly known as sister. When the pharmacists need to carry out the ward checking, they need to see the sister of the ward straight away and inform her that they'll be doing the ward checking on the spot. The sister will have to follow the pharmacist and witness the whole ward checking session. Okay, let's continue watching the video now.
Jessica, we are going to do the ward checking today.
Okay, sure.
After informing the sister about the ward checking, the pharmacist would now proceed with their ward checking. So, where would that check? Well, of course, firstly, the pharmacist would check the emergency trolley, floor stock, and fridge. They would also check records and legal documents pertaining stocks, dangerous drug, and psychotropic drugs. They would also check the cabinets there in the wards, because nurses will usually keep the old drugs or expired IV drips and disinfectants there. All these expired drugs will be confiscated. Pharmacists would also randomly take drug bins and see whether the drugs are being administered according to what is indicated. If it is not, the pharmacist would query the nurse. Apart from that, pharmacists would also request for explanations from the sister for any incomplete records. Okay, so let's go back to our previous video. Can you see this guy here who's just recording things? Well, he's just not there for nothing. He's actually the FRP who's in charge of grading. Now for each ward, there will be 2 PRP in charge of checking and 1 FRP who will be in charge of grading. So now let's have a close look at the grading paper that he's holding. These are the contents for our grading paper. For each requirement, there is a mark. Let's take a look at this page for dangerous drug or psychotropic. We shall use this as an example. Okay, in the ward, if the place to store the dangerous drug is locked, the pharmacist will put there 3 marks, and if it's not locked, we will put there 0 mark. The total mark for this dangerous drug or psychotropic would be as written here, which is 15 over 18. 18 is the maximum mark here. Apart from that, do you notice that there are some blank spaces here? Okay, we shall take 1.1, the storage, as the example again. For number 2 and 1, they are blank spaces. This means that there is no 2 and 1 marking for this storage of DD. It can only be 3 or 0. This applies to every other requirement that is needed here. Then, lastly, we will total up the marks for each section and calculate the grade for the ward using this formula. This paper must be signed by the pharmacist who checked the ward, as well as the nurse who followed the pharmacist throughout the whole ward checking session. The pharmacist will also write some advice and recommendation in this form. After this, the pharmacist will need to document and record the ward check. Then, lastly, they must also send a report to procurement and supply department.